Hey, this is Leanne Lyday, and tonight I'm going to talk to you from my bedroom because this is the only place in the house that is quiet without children. So the two theories that I chose, the learning theory I chose was cognitive learning theory, and for nursing I chose the Patricia Benner novice to expert nursing model. In my nursing 500 class, the topic that I chose, I use a lot of Benner's theories discussing the different types of nurses and who's best to train other nurses and such. So from our PowerPoints that Dr. Kelly discussed with us this week, I wrote down quite a bit about the cognitive theory. It emphasizes the thinking process, and and to me it's a lot of outside of the box. In nursing, there's so much outside of the box stuff you have to know, and which I'll discuss later on the Benner's novice to expert. When you're a novice, your thinking needs to be more concrete. Like whenever I'm going over how the new nurses are doing, how's your orientation going, you can tell they really struggle with the fact that they don't get straight answers on anything. And a lot of times there's not a straight answer. There's so many different factors that come into play to determine what you're going to do in a situation. There are some things that are black and white, but a lot of it is very, very gray. Some of the subcategories of cognitive theory talk about Gestalt, information processing, constructivist, and assimilation. And in my handout, they talk about simulation, and simulation is very important in nursing school and in on-the-job training when you're doing the nurse residency program in a lot of places. According to Burke and Mancuso, says that simulation integrates principles of social cognitive theory into an interactive approach to learning that encompasses the core principles of intentionality, forethought, self-reactiveness, and self-reflectiveness. So basically they use the simulation, and again with the spiral learning, they'll start out with real basic things, and once they feel that nurse understands those basics, then they keep making the simulations more and more difficult, giving them more and more different avenues to follow, what's going to happen if you do this, this, and this. And also they state in the reading here that nurses function in a constant state of controlled chaos, responding to multiple demands at all times. So with the cognitive learning theory, another thing you have to understand and learn is to prioritize, multitask, what's going to be most important at this certain point in time. So going on to Patricia Benner's, her 5 levels from novice to expert. In her article here, Novice to Expert by Davis and Maisano, she talks about the 5 different levels, and novice is obviously your brand new nurse fresh out of school. They are wanting the concrete answers. They want the black and white. Trying to throw some gray at them is not going to be helpful for them. So like your novices are your brand new nurses that come to the hospital, or your fresh LPN students. The way that you teach them is going to be a different level than the way you teach, nurses that are in their last semester of the ADN program. It's a whole different level. And in the second level, which is the advanced beginner, they still need some assistance from their preceptor, but if you give them just a normal average day, no admissions, no discharges, they're going to be okay. But it's whenever you throw something a little bit different at them that they're going to kind of freak out and think, oh my gosh, where's my preceptor? After you've passed that stage, you're at competent. You're mostly able to use your own judgment. You start feeling more confident in your job. Still like to have that preceptor or your mentor close by. Proficient means you're responsible for yourself, and you may even start to precept other new nurses. You've been around the block a few years, you've had a lot thrown at you, you think you can handle it. And then the expert, you're kind of authoritative, you're like the grandma or the mom of the nursing area. You're the one that everybody comes to for questions. And in a supervisory role like I'm in at work, you know, I don't know the answers to everything, but I know who does. So it's a matter of utilizing your resources and such. So definitely both of these learning theories, the theories and the models, it helps with nursing education, and it helps with, you know, if you're in a directory role in your facility, it helps, you know, guide and mentor the nurses that you're responsible for. Just another thing, when you're using comparison examples and you're teaching these people, get to know them personally and know what their background is. You know, if they're having trouble understanding something and you're talking to them up at this level, find out what they did before they were in nursing school or before they were a nurse, and then try to relate it that way. And I think that you get that special connection with your students, and you get a mutual respect. Thank you very much, and have a wonderful evening.